I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. Buttock augmentation is one of the most common procedure that I do. When patients come into my office, they usually ask, is fat grafting the only option? Is there any other option by which we can increase the size of our butt? Well, butt implant is another option. Butt implants. If buttock fat grafting is the gold standard, why do we even consider buttock implants? So the answer is that in some patients, there is just not enough fat. If a patient comes to me with body mass index of 18 and less, where there is hardly any fat in the body, there is no other option but to choose buttock implants for them. Even though buttock fat grafting is the better option, butt implants will be the option in these patients because of the lack of fat in their body. So what are the complications associated with buttock implants? Number one is infection. Whenever we are putting an implant anywhere in the body, the most dreaded complication is always going to be infection, because usually this infection spreads very rapidly due to the presence of a foreign body, and antibiotics are unresponsive in these cases. So the only option left at the end is to take out the implant, and the surgery is a failure, which can be again repeated after 6 months to 1 year, but the patient has to be subjected to another procedure, and the complications that have already occurred and the patient has suffered add to the grievance. If the buttock implants are put in an institution where sterile techniques are followed, then usually no infection happens. The second complication is extrusion of the implant. This is a consequence of infection, and sometimes the sutures just give away if the implant that has been put has not been placed correctly, or the sutures are placed under tension. Eventually they break down and the implant is exposed, it catches on an infection and has to be taken out. The third very common complication of buttock implant is displacement. The buttock muscle, that is the gluteus maximus, is the largest muscle in the body. It is a very strong muscle. So if the implant is not placed correctly, the forces acting in the buttock are very strong and they can displace the implant from its position. Most commonly, the implant travels inferiorly into the thigh or around the buttock on the side of the thigh into the hip area. So to prevent this complication, these days we put the implant inside 2 layers of the muscle, so that when the muscle contracts, it keeps the implant in its place. This is where the technique of plastic surgeon comes into play, because if he has placed the implant correctly, then the implant is not going to get displaced for a long period of time, and eventually it's never going to get displaced. Finally, we can talk about the need for another surgery. Sometimes after buttock fat grafting, there might be another session required because the size augmented may not be sufficient for the patient. In case of butt implants, this decision is made preoperatively, so the chances of this happening are usually low. Chances of this happening after buttock implants is low because the implant has been chosen preoperatively, the results are reliable, and the size estimated is what the size that the patient is going to get in the post-operative period, and there is no problem like fat resorption or fat necrosis that can occur with butt fat graft. So these are some of the points that a patient has to take into consideration, and a plastic surgeon should explain to a patient looking for buttock augmentation. Please like our video. If you have any questions, please mention them in the comment section below and subscribe to our channel.